What's the most unhinged thing a doctor has said to you with a straight face? During my first delivery, my epidural line broke while I was pushing. I pushed for 3.5 hours. Baby was born and whisked away to the NICU because she was having trouble breathing. Then my placenta got stuck. My OB was having trouble trying to get it to deliver because she said it looked like the cord was trying to tear away from the placenta. She called the OB on call at the hospital. I'll give him a little benefit of the doubt because, no one knew that my epidural line had broken. It never completely took for me, so I still had some pain during labor, but he stuck his hand inside of me to try and scoop it out. I screamed. But then he didn't believe me when I said it hurt too much and tried it again. I have never screamed so loud in my life. Thank God for my husband who stood up and yelled at him to get off me and that I was obviously in pain. Got wheeled back to the OR and put under for them to remove it. Lo and behold, they realized about my epidural. The fact he didn't believe me is just baffling. Next story. At 30, with my MRI, that I didn't actually get to read myself for 10 plus years in her hand, showing all the inflammation, the remodeling, the calcified ligaments, the stenosis in my spine, the narrowing, the bulging, the fusion of my joints. You're too young for arthritis. She could have slowed it down and added literal years to my active lifestyle, but instead she gaslit me, told me the pain was in my head and that I needed to lose weight. I was a healthy 160 at 5'8", saying there was nothing medically wrong with me. Now I'm 46 and I'm diagnosed with a form of spinal arthritis that's already fused several joints in my spine, hands, and other extremities. I'm in constant pain and I rarely leave home anymore because moving hurts and it's exhausting being in pain all the freaking time. Next story. From my wife. She got an IUD and hated it. It was painful to have it inserted and it made her feel like she was going crazy. She couldn't hold a thought and it changed her hair texture, just weird stuff. This was after about 3 months. She went to the doctor to have it removed and he told her no because insurance had paid for it and it wasn't a good use of their funds to take it out. She tried again a week later and he said no because it was all in her head. She changed gynos to one that was by women for women and that gyno took it out with a local anesthetic on her cervix without questioning why. I've heard plenty of IUD horror stories in my time. Not necessarily this, mostly that it just hurts like hell putting it in, which, makes sense. But this is just so strange. Like, hey, can I have this device that's like altering my body chemistry removed, please? I think it's doing weird things to me. Nah. Next story. At 16, I had excruciating stomach pains. I was having a period at the time, but it was not that sort of pain. Even at 16, I knew the difference. The GP dismissed it as period pain, and when I said it was much more severe, he suggested a miscarriage, even though I told him I wasn't intimately active. He sent me away anyway without even examining me. I lived in a children's home at the time, and that night I screamed the house down, apparently. I have no memory of it. I guess I passed out or something. An ambulance arrived very quickly, and at the hospital, I was rushed to the operating theater. My appendix had ruptured, and I had peritonitis too. I ended up in the hospital for 3 weeks. Fun times. Next story. There's nothing wrong with you. Turns out I was being poisoned by a work colleague. Regularly. I was working with a guy in hospitality. He was disgusting with the way he spoke, including female clients. He would joke about banging with women constantly. I have recordings about him talking about how big his dong was. I've kept these to this day. One day, me and another colleague caught him in a chat with a minor and he was talking inappropriately. This was in our main freaking office. The police were called, but they didn't touch it. Literally in their hands. Head office got wind of this and started to protect him from me and others. I wasn't in a position where I could lose my job at the time, so I had to continue working there. So in the time I worked there, I got seriously ill. I went to the doctor. Doctor thought it was a virus. It subsides, and I'm normal. It happens again a week later. I literally couldn't stand up. This time, hospital. It dissipated, and I was normal again. I noticed my water would taste funny. I asked my manager if his water was tasting funny. I mean, we all get it from the same source. There were over 100 people drinking the same stuff in the same building. I drank this water thinking nothing of it. This person would come into the office wearing gloves for cleaning. He was asked why he was wearing gloves. He replied, "Cleaning." It wasn't for cleaning. I noticed him screwing with my water. He was filling it with cleaning acid and hand sanitizer. The mother fricker was poisoning me. By this time, I had been to the hospital where my left arm was going white up to my shoulder. Again, nothing wrong with me. I told them what was happening and I got looked at like I'm crazy. Luckily, I had a friend with me that was a nurse. This had been happening over 2 months. I contacted the police. That needed evidence. We had CCTV, but it was getting wiped, and he had access to it since he worked in that area. I also gave the police my bottles. They failed to test them, which was freaking annoying. So basically, everyone that should have given a crap let let a predator get away with their predator behavior. Now everyone knows who he is via social media. He hides behind a persona that he's a good guy, he's a photographer, much like Peter Parker, except he will nonce your kids. Edit. Forgot to add, with this jerk doing this, I was in and out of hospital for the first few months with symptoms of weakness, excessive sweating, double vision, extreme nausea, skin turning white, dried mouth, antihistamine didn't help, and blood pressure was always slightly high and nothing was found in the blood. However, my liver enzymes rocked up and I am teetotal. I did get told to stop drinking by one doctor, and yeah mate, I don't. Never doubt yourself. Next story. I'd been uncontrollably vomiting for about 2 years, and I was sent to a second consulting gastroenterologist who looked at me in disgust without an exam or listening to my concerns and said I just had acid reflux. I asked him if that explained the vomiting, and he said, "What, are you afraid you're anorexic?" Which is screwed up for 2 reasons. I'm a fat girl, and I believe the word he was looking for was bulimic. He then left the room without another word. I went to the front desk where they tried to schedule me for a follow-up, which I declined. I then mentioned to the 3 extremely overweight ladies at the front desk that they should let him know that fat jokes aren't funny, and they were mad. One set down the folders she had in her hands, put her hands on her hips, and said, No, they are not. I said I had additional questions I needed answered and that he walked out on me. They spoke with the doctor whose office was immediately attached to their area, so he was literally within feet of me and he refused to come out. He called a phone at their desk and had the ladies transfer the call to the phone I was next to. I fired him immediately. Next story. Surgeon. I can't do this surgery. I don't wanna. I have an obstruction, an intussusception. It needs to be fixed. I don't want to die. You won't die. You can live with an obstruction. And he walked out of the room. He discharged me. I went straight to another hospital and they did an X-lap and small bowel resection. Reported the surgeon. Genius documented that I'm supposed to live with an obstruction. Edit. This would have been my second small bowel resection, as this was my second intussusception. It was a complicated surgery, I get that. But him telling me I could live with a bowel obstruction was unhinged. Next story. I was in a lot of pain. My neck and shoulder muscles had been in spasm for 4 months. The pain specialist told me it was fibromyalgia. Instead of referring me to a rheumatologist, she told me that women with fibromyalgia, as a rule, were abused as children. She literally took me by the hand to the psychiatrist in the next office and left me there. The woman psychiatrist reached for her prescription pad and said, "Of course you're depressed. You're a woman." The next day I was diagnosed with thyroid cancer. I feel like this is just going to be like an hour of stories about women not being treated properly by medical professionals, right? Surely that's going to be the vast majority of it. I don't even understand how this happens. How hard is it to just treat everyone like a person who could have a medical issue and examine them properly? Admittedly, I'm not a woman or a doctor, so it's a little hard for me to speak on the subject, I guess. Next story. A doctor refused to do any tests and told me I had housewife syndrome when I was dying of pernicious anemia and toxic thyroid. When I was hospitalized in a coma from untreated pernicious anemia, the ward doctor tried to pull me out of bed saying I was faking a heart attack. I could not stand up and could barely speak. Luckily, the doctor running emergency knew me, saw how sick I was, organized blood tests, and insisted I be admitted. The next day, I had to explain to the ward doctor that I had a rectocele. He turned to his 2 interns to make sure they laughed sarcastically at me with him and said, "Don't worry, dear. As soon as we go to the beach, we'll find you a wrecked seal, doctor." The ignorant doctor had never heard of a rectocele or even pernicious anemia. The doctor diagnosed me with manic depression 5 minutes into my first visit and prescribed me lithium. I asked if I should see a psychiatrist first, and he insisted there was no need, saying I wouldn't believe how many cases of manic depression he diagnoses every week. The pharmacist refused to fill the prescription, saying the doctor just prescribes it for every patient, and the lithium would interfere with other medication I need. I told a doctor who was half an hour drive from my home that my severely handicapped baby's heart kept stopping. He told me next time to drive baby to his surgery without reviving him so he could diagnose him. Another doctor, when this child was 4, called him a vegetable to his face and ordered me to place him in an institution, saying everyone in my family would hate me if I didn't. Tonight, 42 years later, that son has planned, bought for, and cooked a delicious roast dinner for our family. Next story. Went in to get an official diagnosis for a tropical disease I'd picked up while working in the Amazon so I could get it treated. I knew exactly what I had. Mucocutaneous leishmaniasis, a nasty parasitic disease that that wreaks havoc on you if left untreated. Doctor looked at the extremely clear symptoms and said, nothing there. Are you a tweaker? When I indignantly asked what the hell they were talking about, they said, well, a lot of tweakers say they have bugs under their skin. Then they wanted to know more about leishmaniasis, as they'd only ever read about it during medical training. Eventually, I found a doctor originally from Peru who knew what they were doing and recognized it right off, but screw that first doctor. Next story. When the IUD I had before my current one was placed, the gyno winked and told me he gave the string the husband snip. Cut it super short. Mind you, I mentioned that my husband never had an issue with the string with my last 2 IUDs. I couldn't find the string the majority of the time I had that particular IUD, and when I went to get it replaced at my PCP, they couldn't find it and had to send me to a specialist to get it removed and replaced. He also said it was clear I, quote, behaved myself in college and my 20s while poking around for my cervix in an earlier exam. For the record, I absolutely did not, and I regret nothing. So these doctors are just out there saying this stuff to people at appointments, just constantly judging someone's intimate history, and also being wrong about how anatomy works. Stunning. Just absolutely baffling. Next story. My attending trying to convince me during residency that my patient must have been an alcoholic, which is why her liver enzymes were so high. I order a hepatitis panel, and it turns out she has hepatitis B and was in an active flare, which he would have suspected if he listened to me, explaining that I talked to the lady and she told me she grew up in Vietnam, never had vaccines, and was told she had a liver problem diagnosed as a teenager but couldn't remember the name. Not the only time that the attending would accuse patients of random things. Next story. I was living in the Gulf. I wanted to get an STD test, as I do at the start of every relationship where we might forego protection. I went to a female doctor, lied and said I was married but that I wanted to get tested. She tried to talk me out of it and said I should trust my husband. I was not happy. Made her do it and told her she shouldn't tell patients that. It particularly pissed me off because I knew a lot of men in the Gulf and saw how many girlfriends on the side, hookups, and escorts they were hooking up with on a regular basis. And I was so appalled at the idea that some poor wives were picking up STDs from their husbands and going to doctors who weren't testing them and telling them to trust their husbands. Next story. I was in grad school and really struggling with executive functioning. I brought it up to my psychiatrist that I suspected ADHD. He said, well, when I was having trouble concentrating in grad school, I took a break to read Lord of the Rings. Maybe you should try that. I made it through grad school and got diagnosed years later by a different doctor. I still joke about reading Lord of the Rings when I'm having trouble focusing, although meds help a lot. I also saw a neurologist in my early 20s for my chronic migraines who said I should start trying to get pregnant after I clearly stated I wasn't interested in kids anytime soon. He replied, well, there's never a good time to start having kids, and refused to prescribe me the preventative medication I needed since it could negatively impact a hypothetical fetus. I switched doctors and found someone who would prescribe the meds. I also ignored the first doctor's advice about having kids right away and waited until my chronic health issues were under control, as well as after my partner and I both had stable jobs and we bought a home. Hey, turns out there was a good time. I feel like there's an issue with doctors thinking they are way smarter about more things than they actually are. Like, sure, you did med school, that's hard, for sure. But that made you good at medicine. It didn't make you good at life in general. You should help people with their medical issues, not telling them they should have children because it's never a good time because you know better for some reason. I don't know. You're not a guidance counselor. You're just a doctor, man. Next story. That he was qualified to diagnose me as ADD even though he wasn't a specialist because he has enough experience from, quote, dabbling in it. Years later, I would finally understand why my parents took me to a new doctor who's never seen me an hour away for a diagnosis in 45 minutes. Because I wasn't ADD, and they just wanted me on Ritalin so I would speed up. Those jerks can rot in hell for doing that to a confused and vulnerable child, a child who had PTSD, but that's not a fun diagnosis, so he can't have that. Next story. I was having spells of vertical double vision. They would come on without warning and last for 5 to 15 minutes. I would also sometimes lose my vision. It would start with silver or gray spots, cloud-like, and fill my vision and take 10 or so minutes to clear. It was scary and made driving dangerous. I was sent to a neuro-ophthalmologist who was very dismissive and clearly frustrated during the exam that I came in when I could see. I can't control the vision loss. He told me I should come back to him if it happens again and I have weakness or paralysis on one side. I said, those sound like stroke symptoms to me. He said, yes, quite right. I said, then I think I'll go to an emergency room instead, right? He said, suit yourself, and walked out. No diagnosis, no help. A real cool dude. Next story. I went in for extreme pain in my feet. The doctor told me I was suffering from, quote, old white women feet. I'm a guy and was maybe 22 at the time. Asked me several questions about wearing high heels. I laughed at first, but he was really into it and kept asking what kind of heels I wear. Turns out I had nerve damage between my toes. Older women usually get it from wearing high heels over their lifetime. I just have really wide feet that don't fit in most shoes, and the pressure from squeezing my feet in normal shoes caused the nerve damage. Next story. Would I be interested in an arranged marriage with his nephew long enough for him to move to the US and gain citizenship? I was 18 and being seen for a minor illness. This happened in the 80s. He showcased me a picture of his nephew and gave me what seemed like a well-rehearsed pitch for what would be expected of me, how it would go, and what was in it for me. I politely declined the arranged marriage proposal. That is by far the most unhinged thing a doctor ever said to me, even though I've since had some doozies because women's healthcare is often a joke anyway. Next story. I don't think it's true lipoma. I think you're just overweight, which means I'll have to carve whatever this thing is out of your fat, and it still may be there when I'm done. We don't do liposuction here, you know. Spoiler alert, I was overweight, but I also had a 13-centimeter lipoma that grew on my back within 3 months, causing me intense nerve and shoulder pain. The surgeon said this to me on the morning of my surgery right as they were prepping me. Had never mentioned it in any of our pre-op appointments, so I was nervous as hell going in. But I felt much better after I woke up, and the nurse told me, 1, it was definitely a lipoma, 2, it was between the size of a tennis ball and a softball. They were all very impressed with it. And 3, apparently the lipoma popped out as one big piece and almost hit my surgeon in his face because he was so sure it wasn't a lipoma that he wasn't being as careful as he should have and was leaning over too closely. Surgeon came by for literally less than a minute while I was in recovery to say everything went well and I was on lifting and movement restrictions until my next appointment in 2 weeks, then left without another word. I got the impression from the nurses that he wasn't very well liked. Worst part was, the surgeon was obese himself, like clinically obese. Next story. Psychiatrist at an inpatient psych facility told me I should be grateful for my circumstances, that I don't think he knew much about at all because we saw him for like 5 to 10 minutes each week, because at least you don't have to go fight in Afghanistan like some women. Can 100% assure you that my circumstances were nothing to be grateful for at the time, but yeah, I guess at least I wasn't being forced into the military. At the end of every conversation I had with him, would also put one hand in the air and another on his heart and say that everything was going to be fine since it was in God's hands. It wasn't a religious facility, nor am I religious either. It was just uncalled for. I did call him out on that one. Proud of younger me for that, especially since I was so unwell at the time and very unseasoned at standing up for myself or having any boundaries at all. Next story. I woke up with a very fast and irregular heartbeat and passed out as soon as I tried to stand up. I also threw up several times and was unable to get up and kept seizing. An ambulance was called for me and the EMTs took care of me and said my BPM was at 200 the entire drive there. At the ER, I waited so long for a doctor to come see me and just take my temp, put their hand over my stomach and say, "Sounds like you have a tummy ache." I was diagnosed with long QT syndrome by a different doctor later. Next story. Not a doctor, but a dental office, so pretty close. I'd had to reschedule an appointment because my cat was diagnosed with cancer and the oncologist had a cancellation on the same day as my dentist appointment. Well, you bet I rescheduled that dentist appointment. So on the appointment day, I'm seeing a different hygienist and she asked how my cat was doing because she'd heard why I rescheduled. I said we were pursuing treatment and we were hoping for remission. Well, you should get 2 kittens, so you'll still have cats around when your cat dies. I'm still seeing the dentist because he's a good one, but I am never seeing that hygienist again. This hygienist either had no idea what you meant by remission, or they were like, I don't know, morbidly glass half full, because they're still like, oh, you know, it'll be okay, you can do this. But the presupposition that your cat is gonna die is, I don't know, not super kind or empathetic. Who knows what was going on in their brain? Next story. Last year, I went to the University Counseling Center and put in my intake that I wanted to speak with someone who is trained in neuroaffirming care. I think they ignored my intake form and gave me the earliest appointment possible. It was a man and I'm a woman for context. In our first session, I said to him, well, I wanted to talk about potentially having autism in addition to my ADHD. I'm scheduled for an assessment, but since figuring this out, I've been grappling with a lot of things and want to talk to someone about it. He kind of scoffed, looked at me and said, well, I've been talking to you for 5 minutes and I don't see any signs of autism. I was officially diagnosed 2 months later. In that same conversation, he kept wanting to pivot to whether I had a history of depression and anxiety. Of course I have, but that's not why I was there. And then tried to convince me to get on medication. I told him I had a bad reaction to medication in the past and therefore didn't want to go on it. Beside the fact that depression medication won't cure autism or help me unpack my trauma from being undiagnosed until my 30s, he literally rolled his eyes and in a frustrated tone said, "Whatever, we can talk about it next week." I found a neuro-affirming therapist and I've been working with her for a year. She's legit amazing and I'm doing so much better now. Admittedly, I think this is where I need to do some learning. I do not know what a neuro-affirming therapist would be or do, because just the word neuroaffirming to me sounds like you wanted a therapist to tell you you have it and that you're right, but that's surely not right. I don't know, it sounds like OP more so just wants a therapist that understands these sorts of mental conditions, doesn't belittle them like the guy they got, but I don't know, the verbiage on it feels really weird to me for some reason. Because to me, going to therapy with the goal of hearing a specific thing from your therapist is no longer productive, but maybe I just simply don't understand what OP was looking for. Or admittedly, how therapy fully works, because I am not licensed, I'll tell you that right now. Next story. I should preface this by saying I've worked in both the ER, OR, and sick call/urgent care as an RN for over 20 years, retired recently, and moved to a place away from a VA hospital. This was my first experience at the ER serving my new community. My goober of a dog, 90-pound lab, flopped onto my hip as I was laying on my side. I felt an immediate pop with pain, tingling, and weakness in my legs. I dealt with it for 2 days, because I still believe that Motrin, changing socks, and drinking water will cure everything, I guess, but I gave up and went to the ER. ER doc. "You know, an MRI is a very expensive resource, and someone else might need it more." Same doc after I had to convince them to order the MRI, as they're walking out. "Fine, I'll order it, but I doubt it will show anything." Same doc again after the MRI. "Your MRI was normal." Pause for effect. "Okay, well, not normal. You have 2 herniated discs and you need to see neurosurgery." I saw neurosurgery the next morning and had surgery the day after. Miserable experience, and a complaint was filed. Military medicine gets a bad rap a lot of the times, but I never experienced the level of BS and gaslighting while active duty that I did here. Next story. I had to get some paperwork filled out for insurance. The insurance provider was to pay the fee to have the forms filled out. The doctor refused to fill out the official forms, saying, "Sometimes they reject the forms and then you're on the hook for the bill to fill them out. If I give you the information on a regular prescription pad, it only costs you $10 and it's done." The information on a regular prescription pad was rejected by the insurance provider, with the explanation that they expected the information to be on the indicated forms. I had a follow-up appointment with the doctor, where he mentioned the unpaid $10 for the slip of paper he filled out, and I told him I wouldn't be paying it because it was rejected by the people who requested the forms in the first place. His response? "That's a nice little scam you've got going on there." So I go see him and request specific forms to be filled out. He refused to fill those forms. His alternative was rejected, which meant his solution had 0 value to me, and consequently, I refused to pay for it. In his mind, that was me running a scam. Yes, I go around asking doctors to fill out forms, hoping that they do something different and try to charge me for it, and then I refuse to pay for their worthless paperwork, and that way I get worthless paperwork without paying the $10 fee. I am so enriched by my scam. You wouldn't believe it. That was my last time seeing that doctor. Next story. I got COVID a year or 2 ago and was actively dying. I couldn't breathe well and my head and throat hurt so bad. I went to the doctor thinking it was strep throat or something and got diagnosed with COVID. She said they couldn't give me anything to help and to just tough it out because, quote, "you seem dark enough to be strong." I wouldn't say it's unhinged, but it was definitely not what I expected a doctor to tell me while I was struggling to even think straight. My friend also had COVID and got 3 different pain meds from the same doctor later on. OP, my only hope is that you hallucinated this in your fugue state. What the hell do you mean? You seem dark enough to be strong. That's crazy. This person should never be able to interact with humans, let alone practice medicine. Next story. Back in 2021, I was working at a summer camp and realized a small purple dot was on the side of my foot and was beginning to itch. Over the next 48 hours, the dot grew and grew. Surrounding areas were red and my foot became swollen. Something was definitely wrong, but I had no idea what it was. I eventually caved and left camp and drove myself to the doctor, with my best friend and roommate tagging along. This is all relevant. My best friend went with because she also wasn't feeling well, but hers was more sickness and injury, whatever I had going on. Doctor gave no information, no clue what it was, but gave me a pain relief shot and some antibiotics if I remember right. I returned to camp and my best friend went home and later found out she had COVID. I tested myself and also had COVID. However, really didn't have many symptoms at all. Because of this, we were both sent home to quarantine. My foot continued to get worse. It was so swollen, I couldn't wear a shoe. I started using crutches because I couldn't put weight on it. It was still centralized to one part of my foot, but the once small purple dot had since grown to a larger, maybe 1 to 1.5 inches across, gray spot that had bubbled up some. I later realized this was necrosis. Awesome! Because I was quarantined, I could not physically go into the doctor's office. I was instead tracking progression of things with photos and had 1 or 2 virtual appointments with my GP, at which point she recommended I go to the ER because it had been over a week. I had a fever, and we weren't sure if it was because I had COVID or because whatever was wrong with my foot had possibly caused a blood infection. I drove myself to the ER, the first and only time I've ever been. After waiting for 30 minutes or so, the doctor comes into the room, takes a look at my foot for a good 15 seconds and says, "I think you have foot herpes," which I didn't know was a thing, and upon Googling images, it was definitely not. I thought he must be actually freaking stupid, to be honest. He goes on to tell me that I can get foot herpes if someone with herpes was kissing my feet while I had open wounds. None of these things happened. I'm so confused. He then tells me that someone will come swab it and run an STD panel on my foot, then get back to me with the results later. Next thing I know, I'm being given discharge paperwork and told they'll get my results to me in the next day or so. No one ever swabbed my foot. When I said no one swabbed my foot yet, the reaction of the nurse was as if I had asked her to scrape crap off the floor with her bare hands. Mind you, it looked rough, but there have easily been far worse things, and I'm sure the ER saw many worse things that day alone. Obviously, the freaking foot STD panel came back negative, and I had to pay for it anyway. Despite the context of when and where I was when my foot started hurting, foot herpes was put into my medical notes. Yeah, it was a spider bite. It was a brown recluse bite because I was living and sleeping in the woods and cabins for weeks. My chart probably still says somewhere that I was diagnosed with foot herpes back in 2021. Moron. Next story. I was a kid, like 7 or 8, getting a full allergy prick test. Back then, this meant they poked you on your back about 30 times with a different allergen in a grid and look at it later to see what you reacted to. After about 5, my poor little kid body was done and I started squirming. Instead of asking me to be still and acknowledging it was a painful process but necessary, the doctor said if I didn't stop moving, they would strap me down to the table. Again, I was like 8, and then he and his aide or nurse laughed about it. Scared the crap out of me. I'm actually surprised my mom didn't punch the guy. We never went back to them after getting the results. I feel like this was probably just a joke, right? Like, it doesn't feel that crazy to me to make as a joke. I guess OP took them more seriously for some reason, but 7 or 8 seems old enough to understand that they weren't serious if they weren't. So I can only assume that they seemed deadly serious about it, but I don't know. Maybe this is crazy, but this one feels much ado about nothing for me. Next story. I hope you find what you're looking for. Not as extreme as other stories here, but this is what my GP threw over her shoulder as I walked out after asking for a referral to an adult autism diagnostic service. She had decided I was trying to get undeserved government disability benefits. It was the 4th time she'd expressed a doubt over a request of mine, with 2 of those times resulting in a panicked phone call from her later because the scans that she'd insisted we didn't need showed a severe fracture requiring urgent surgery in my son and a cervical spinal cord injury in me. I was eventually diagnosed with ADHD, and I don't receive benefits even though I'm probably eligible. Screw you, Sarah. Next story. That getting pregnant would be the answer to my horrendous hormonal issues. I've never wanted children because I have multiple health issues, and the subsequent financial instability that often accompanies chronic ill health. So I know I wouldn't be able to properly care for a child. It wouldn't be fair to them. I also pointed out to him, a highly regarded, internationally renowned private gynecologist who I was paying £300 to see each time, didn't have insurance, that some women's hormones get worse during pregnancy and or afterwards, sometimes permanently. And even if my hormones improved during pregnancy and also didn't get worse afterwards, they would likely just return to how they were before pregnancy, which was pretty terrible. How could I be expected to care for a newborn with my messed up hormones, chronic health conditions, and then sleep deprivation on top of all of that? He basically wanted me to bring a new life into the world on the off chance I'd have 9 months of better hormones, as if a baby is something you just use for your own purposes. He became angry when I tried to discuss this with him and threw his hands up shouting, "Oh, you just do what you want." I started crying because I'd honestly thought he'd be able to help my debilitating hormonal issues, but instead I'd spent money I didn't have to be given a ridiculous treatment plan and then shouted at. In the letter he sent my GP afterwards to go in my notes, he stated I was non-compliant and scared of being pregnant. Yeah. Next story. I went to a gum doctor because of my receding gums. He was talking to me about how to get a gum graft with his gloved fingers in my mouth, touching the roof to tell me that they'd take the skin from the roof of my mouth and turn that into a graft. With his hands in my mouth still, he told me I would probably be able to only eat liquids and soft foods for a couple weeks, but that's great because I would lose some weight. Then said nothing for like 15 minutes while he kept probing the roof of my mouth. Next story. Not me, but my wife. I go with her to some appointments because, quote, you need to come with me to hear what they say. Background. I never doubted that her doctors dismissed her, but I always assumed she was paraphrasing. I was wrong. On chronic pain caused by EDS. You could go to a chiropractor. I don't know what they do exactly, but that's an option. On complications from nasal surgery that turned into sepsis. You have really thin skin. The surgery was just awful. Also, you have very brittle little bones, like a bird. No idea why he tossed the thing about bones in there. On insisting that a very bloody and messy procedure be done bedside in the ER. I don't want to wake the attending surgeon for this. You probably need anesthesia, but we'll do a local. On new and recurring period pain and bleeding that left her nearly bedridden and constantly nauseous. Sounds like it's just a wacky period. Next story. Well, when you're still in here 2 days and still in labor, don't come crying to me. I was being induced and was sobbing and begging for an epidural because I was in so much pain. He tried to convince me not to get one because I was only 2 centimeters and it would apparently inconvenience him. So I was in pain and basically being belittled for 15 minutes while sobbing. Finally got the epidural and he said that. Went from 2 centimeters to fully dilated and pushing in less than 2 hours, so that's why I was in so much pain. Precipitous labor. Next story. I've been struggling with chronic pain from a bad hip joint for many years. One specialist I saw told me, it's because you have kids. I do not have kids, nor have I ever been pregnant. The MRI clearly shows I have no labrum left and the bone is getting caught trying to move in the hip socket. I tell him, no, I do not. He looked at me with a straight face and said, you should get pregnant then. Maybe that'll help. What the actual hell? This was a pain specialist, not a freaking OBGYN. The worst part? I've had 3 doctors tell me to get pregnant to fix my clearly orthopedic pain. In Canada. I am just so tired of this crap. Next story. This was a long time ago, so the dialogue is paraphrased based on what I remember. I was trying to get an appointment for a pap smear with my doctor. Those are for women, she explained with a very condescending look on her face. I'm transgender, I reminded her. I was assigned female at birth. She still seemed extremely confused and eventually said slowly, but there's nowhere for the swab to go down there, you see? Oh, no, I haven't had any bottom surgery, I explained, naively thinking that I'd just figured out the source of the confusion, just a mastectomy and hormones. She just looked at me blankly, so I tried to clarify further. I have the part, I said, just a normal female part. She was looking at me like I had 2 heads, and after a long pause, she eventually mumbled, I don't think we can do that. I don't know. I eventually just convinced her to book the appointment and that the nurse would know what to do, but she genuinely looked so confused. She'd been my doctor for years at that point, since way before the transition, and, had full access to my medical records, so I have absolutely no idea what on earth she thought was in my pants. She was just such a dedicated ally that she couldn't imagine you having transitioned at all, I guess. Just fully overwrote your assigned gender and replaced it with what she knew. I'm joking, obviously. There's definitely some confused ignorance at play here. Or she was just having an off day and truly had no clue what was going on. Next story. My wife had trouble breathing and everyone assumed it was because she was fat. I lived with a woman for 20 plus years. She was active and moving around until she had trouble breathing in her later years. She had a lot of symptoms related to sarcoidosis, but the doctors waved it off. Sarcoidosis is an autoimmune condition that attacks your lungs. One of them was one of the top pulmonary specialists in the area. After waiting a year to get to see him at great expense, after a volley of tests where his staff were like, yeah, this is sarcoidosis, just look at the x-rays and MRI scans, the doctor gave my wife a 1950s-era pamphlet on weight loss. When we explained again the results and everything, he chuckled in a patronizing way. It's like you want me to find something wrong with you. Yeah, dude, you're a freaking doctor. My wife died 2 years later from sarcoidosis. I demanded an autopsy. Now, I don't blame any of the doctors for her death. Sarcoidosis is incurable. She was gonna die, no matter what. But "Welp, you're fat. All in a good day's work. Pay the receptionist as you leave" attitudes of most doctors was freaking infuriating. Next story. A couple have given birth to a child. Immediately you see it's not completely healthy. Big tongue, blood vessels popped in the face, looked a bit like a horror baby. They tried to be happy, positive, love her, etc. At the hospital, a few nurses and a doctor were looking at the child. She's been with them for days or weeks then even. The mother says, "Oh, looks like she's hungry." And a nurse deadpan says, "Looks like Down syndrome if you ask me." That was about a year ago. They were our roommates when our kid was born and we stayed at the hospital. The kid does not have Down syndrome. She has a growing disorder, and with luck, she'll have a normal life starting at 6 to 8 years old. Next story. Fair warning, this turns into quite a long rant, but it was just such an insane statement for a doctor to make to a patient. It boggles my mind. So listen on if you have the time and or patience. First off, technically this was my mom's doctor, but A, she doesn't have Reddit, and B, I was accompanying her to one of the appointments and heard at least some of this for myself, so I can confirm how awful this woman is and that my mom wasn't exaggerating at all. So important context. My mom spent years with an awesome GP who she loved, but then he retired suddenly after his wife started experiencing problems with dementia. It was a very sudden decision on his part, and between his own staff and the small town hospital whose umbrella under which he worked, they all kind of panicked at the short notice. So they all just took his patients, and because most of his patients were older, mom included, most of them were on a laundry list of meds he'd been prescribing them for years, and they just couldn't stop. Plus, many of them had scheduled appointments upcoming and didn't have a great deal of time to find new GPs for themselves with all these factors. The hospital and previous nurses agreed to just automatically send all of those patients to another doc at that hospital without any of his old patients' foreknowledge or agreement. They just got letters informing them, "Old GP is retired, so-and-so is your new doc. Go to your next appointment as scheduled, but with them instead." My mom was disappointed because she legit liked the old GP, but more than that, she was concerned. Turned out to be rightfully so. See, my mom broke her back at the ripe old age of 17 years old in a bad car accident, and it's been deteriorating ever since. Spinal stenosis, disc degeneration, etc. Pretty much everyone gets back problems as they age, but a broken back at 17 really stacks the deck against ya. So, when it got too unbearable, she finally had to acquiesce to the big, bad pain pills. The opioids. She's almost 80 now, and she knows she'll be on them for the rest of her life. She takes them as sparingly as possible, not to get high, but they are still opioids. If she were to stop them, she knows she would get withdrawals, and at almost 80, between that and the pain, it would probably end her. So she had her first visit with this doctor. Well, first, she complained about getting all the old GP's patients because he left her, quote, a bunch of drug addicts. Remember, these were almost all elderly people in similar situations to my mom. Then, when my mom, and in the latter visit I, pointed out the thing about the pain and withdrawals and what it would do to someone at that age, she literally said, "Why do you want to be alive at your age anyway?" Again, I want to point this out, that I can confirm this because I accompanied her on her next and last visit where she repeated something similar, but then she tried to backtrack and make up things that never happened. For example, tried saying my mom told her XYZ when I was sitting there literally the whole time and she said no such thing. Then she goes, "Oh, well, I must have misheard," and other preemptive butt-covering type stuff. After I told her that her behavior was unacceptable and that I'd be making a complaint. She was clearly used to bullying elderly patients and never thought one might bring a relative with the guts to stand up and properly advocate for them. We're actually still in the process of pushing the hospital to act on the complaint, as like most places of business, they vastly prefer rug sweeping such matters, but I refuse to let them. Needless to say though, right after that I talked to my own GP who I get along with very well. Funny thing about small towns, I used to do both jiu-jitsu and taekwondo with my GP. How many people see their doctors and can immediately start to wrestle and go for a headlock with them? And after I explained the situation, even though he was totally booked and not taking new patients, he made an exception for my mom. So she sees him now and not the Wicked Witch. That woman is in the wrong field. The truth is, Some people can be amazing at the anatomy part, but regardless, should still not be doctors. Like, if I knew the parts of a car inside and out, but also had OCD so severe it caused me to be triggered into a meltdown so intense I'd start slamming my head against the wall, or even popped off and started punching people who came near me because I was so out of it every time I got grease on my hands, I probably shouldn't be a mechanic, right? So, likewise, if you can't even pretend to understand why your patients want to, be alive enough to at least speak to them with minimal basic respect, it really doesn't matter one iota how well you know the human body, now does it? That probably isn't the career for you. I mean, she'd probably be a top-notch medical examiner, though. Not gonna hear those patients complaining. Next story. Luckily, I've had pretty good experiences with doctors. Except one. I'd just come out of my second outpatient surgery on the same knee within a few months, and they were about to send me home. But I still had a hemovac drain attached to me, and nobody had acknowledged or explained anything about it. This hadn't happened with my previous surgery, and I had never seen one before. When I asked what it was, the nurse told me, but was unable to answer any of my practical questions about what to do with it, if it was supposed to come off, etc. They promised they would ask my surgeon about it, but he was in another procedure, and the general vibe was that they were trying to push me out the door. My dad and I raised hell, and a hospital administrator came in to talk to us, obviously because we were perceived as difficult. I'm assuming this person was a doctor. The administrator then started to explain to me like I was a toddler how gravity and blood clots work, and how this thing was supposed to help me with that. I would call it mansplaining, except it was a woman. I was like, lady, I'm in grad school at this same teaching hospital, and I know all of this. What the hell am I supposed to do with it? Finally, the poor PA was able to come out of the OR and give me instructions, apologizing profusely, and even gave us his cell number if we had any questions. 10 out of 10 score for him. Negative 20 out of 10 for the admin. Next story. I had a doctor tell me, a 12 to 14-year-old girl, don't remember the exact age, I was young though, who was seeking birth control for pain management. I became dysfunctional on menstrual, nausea, stopped eating, dehydrated, all the joys. Much better now since switching off lead-filled disposables. That he wouldn't allow me to have such pills because, quote, what if your future husband doesn't want a wife that took this kind of drug in her past? There's implications to this drug that you shouldn't be old enough to understand, but you do understand. Which we both know is why you're asking for it, because periods don't get that bad. I'm in Canada, and it was the 2010s. Next story. Once went into an eye exam, and as the assistant doc had a lens up to my eye looking closely at it, taking a bit longer than usual, they exclaimed, "Oh, that's so cool." As a note, having a doctor look at any part of your body and exclaim that anything is cool is not something you should want to hear. Come to find out, I have some sort of golden ring around my eye that can lead to an increased risk of glaucoma and other eye abnormalities down the road. Apparently, it's nothing to worry about immediately, but it's certainly rare to see. I saw a close-up picture of what they're talking about, and okay, I admit, it looks kind of cool, but I'd very much prefer to have a normal eye with no weirdness going on. Next story. When I was in high school, I started having problems with my jaw. I was having difficulty opening my mouth to eat as well as clicking in the joints. I later found out that it was TMJ. I was showing and explaining to my dentist about the symptoms and asking what was happening. My dentist told me that I was dislocating my jaw to show off to my friends and that I needed to stop. Despite my claims that this was untrue, he insisted I was doing it on purpose and admonished me. Never went back to him again, but I also never got treatment for it. The condition improved on its own. Man, I wish the problem with my jaw went away on its own. Opie, you're lucky as hell. I have the most annoying, jaw clicks and, locking and stuff only on one side, so I know it's something screwy. And it did not happen before a few years ago. Honestly, I kind of picked the wrong business to get into, all things considered. Next story. My mom took me to a child therapist due to me having severe insomnia after losing our family cat. The therapist spent a single hour with me, where she emphasized that if I were dishonest about the slightest thing, she would never trust me again after that, and concluded I had full-blown clinical depression. My mom wasn't convinced and told her about the cat. The therapist responded, "Oh, come on, who gets sad over a cat?" My mom practically snatched me out of there, thankfully. Edit. The next therapist I tried was also stupid as hell. I mentioned how the neighbors' barking dogs were worsening my sleep even more, and that earplugs helped, but even then I could still hear them sometimes. For some reason, this idiot thought I was referring to auditory hallucinations and just stared at me all scared until I cleared it up. Next story. I don't personally remember this because I was in so much pain I couldn't walk or talk, migraines, and apparently the doctor told my mom, "She's in her teens. They're dramatic. Give her some Tylenol and she'll be fine." This was after I'd been throwing up from pain, and I'd taken several meds over the past 3 days, none of which helped, and the pain only got worse. I went to urgent care, got her isotryptin, my beloved, and put in patient. Turns out I had some muscle spasms that shifted my spinal column around, and I pinched nerves at the base of my head. Still get migraines, but never anything like that again. Next story. I showed a doctor clear symptoms of joint hypermobility, and she said, "That's normal for you, so it's fine." I literally just said it causes problems for me. Proceeded to tell me that my debilitating chronic pain was caused by vitamin D deficiency, and I should go do yoga about it. Ignored everything I said about my symptoms and family history. This was my first appointment with her, and I did not go back for a second. The kicker here is I have freaking textbook fibromyalgia symptoms, which I already knew because my mom has fibro, and we have the same symptoms and pattern of onset. Apparently, I was just supposed to do yoga, vitamin D, and eat more vegetables for an incurable condition. Next story. I had a GYN surgery, and I wasn't healing correctly. I had to go back every week and sit on the table undressed for an hour or more, waiting. Every week. One visit, I told my doctor that I was frustrated with waiting like every time. She said she has other patients who had more important issues, didn't even apologize. I was on my cycle with atrocious cramps, so I started ugly crying when confronting her. She ended up telling me I needed to leave my relationship and get a real job. Mind you, I had been working full-time, but wasn't cleared to return to work because of the surgery she did. Needless to say, I refused to see her again. Next story. Oh yeah, there was the time my hubby was in the hospital for an infection in his leg. Compartment syndrome. Cellulitis going too long untreated. One set of docs said he would be discharged in a few minutes. Less than 2 minutes later, another doc said he'd be having emergency surgery on a Sunday afternoon. Happened to be that day. It was to keep the leg from amputation. I said, "That's strange," because he was told he'd be discharged today. The doc bolted from the room and on his way out said, "Don't sign any papers for discharge." He had to make sure the hubby didn't get discharged from the hospital by other docs. That was a scary moment. Next story. I had hyperthyroidism for a few years and was extremely in tune with the symptoms when my medication level was off. My previous endocrinologist, when I lived in another state, had established with me that I only felt good when my TSH was technically a bit too high per the standard lab ranges. This newer doctor knew that. I came in presenting the laundry list of hyperthyroid symptoms and asked for medication adjustment. She told me that if anything, she would adjust it in the opposite direction. I knew she was wrong, so I did the adjustment I wanted to, and magically all the symptoms went away. When I presented her with this information at the next appointment, she first told me it was placebo, and then, when I pointed out that adjusting my medication in the wrong direction would cause other symptoms rather than none, she backpedaled and told me, "I think you have an underlying anxiety disorder." I didn't. "And you like being hypothyroid because it takes the edge off." Next story. My oldest began having repeated tonsillitis and strep throat infections constantly beginning at 6 months old. Once he became resistant to amoxicillin, his peds sent him to an ENT for an evaluation. The first ENT was so rude. Literally greeted us by saying, "Why are you here wasting my time on a baby? You know we can't do anything until he's 3. No, I didn't know that. I'm not a doctor, but my son's doctor sent us. That's why I'm here." It was so weird. Then he accused me of not cleaning my home well enough since my son is always sick. I was floored. At checkout, I told the office manager I was never coming back. We saw a different ENT a week later, and it was night and day difference. My son's tonsils were insanely enlarged, and he was scheduled for removal surgery the day after he turned 2. Next story. It's perfectly normal to bleed for 7 weeks. We will see you in 7 weeks for your scheduled appointment. The provider then rolled his eyes, huffed and sighed with annoyance, and gestured in a scram sort of way with his hands. This was in the middle of summer, and I was wearing white shorts. Blood was literally trickling down my inner thighs. This was at an OB/GYN office. I waddled off to the closest bathroom, called my primary care provider, who usually doesn't handle GYN issues, and explained the circumstances. There was a moment of awkward silence, and then, yeah, that's not normal at all. I've got a close friend on duty at another ER nearby. I'll call him and let him know you're en route. I grabbed a massive handful of paper towels from the bathroom to cover my driver's seat with, and then drove to that hospital. They had me in an operating room within an hour of arrival. Next story. The ER doctor decided that the intense abdominal pain I was experiencing must be due to ovulation. He sat cross-legged in his chair and proceeded to explain how a woman ovulates, and that my pain was due to how egg bursts from the follicle. Now, I know that sex health education is pretty poor in the US, but after 22 years of menstruation, I am positive I've been ovulating far longer than that doctor has been doctoring, and I should know by now when something is abnormal. Turns out a twisted ovary due to a bleeding cyst 3 times the size of the ovary isn't normal ovulation pain. Did the ER doc apologize? No. No, he didn't. Next story. My doctor refused to let me test for STDs. I always get tested before and after a relationship. Did you use protection? Yeah? Well, you didn't get pregnant, so you're fine. Bro, that's not how that works at all. So I had to start lying to him and tell him that it broke or I didn't use one. Then he basically started calling me a harlot. Luckily, I was able to find a new family doctor at the time. I'd be stuck if that were to happen now since it's gotten so bad in Canada with family doctor shortages. Next story. I've watched doctor after doctor tell my physically disabled father that it's all in his head. He's been disabled since he was 33 after a fall, followed by a medical accident. He's now 78 and they've finally taken malingering off his chart. He became disabled before I was born. I've watched him fall multiple times despite using 2 crutches at all times because his legs just give way. I've called the ambulance for him when I was 11 because he was having heart palpitations and chest pains, something he's been hospitalized with multiple times. I've watched him fall asleep anything up to 8 times a day most days. I've watched medical professionals be convinced he's had a stroke when he wakes up from these naps because he has palsy in his face and can't speak for the first few minutes. Only doctors who haven't read his chart yet. I've had them look at 12-year-old me like I know nothing because I insist it is not a stroke. This is his and our normal. I've never played a physical game with him. He's missed important events and appointments because his short-term memory was affected by the medical accident or he's been unexpectedly hospitalized. I've had to sit mortified in restaurants and stores waiting for him to wake up because once one of those naps kicks in, he can't mentally function if he doesn't get the short sleep in. I've dealt with his uncontrollable rage if he's accidentally woken during one of these episodes. I've seen one side of his body flare up with visible symptoms, waited for an hour or more to use the bathroom because he's suffered diarrhea almost every day since the accident, etc., etc., etc. One doctor didn't believe him and wrote something on his chart that affected his medical care for the next 40 years. Screw that guy. Next story. This is work-related, but a doctor was mad that I didn't think a patient with Parkinson's disease with advanced dementia who was unable to follow directions was an appropriate candidate for speech therapy for swallowing impairment and dysphagia. The doctor said the patient was getting physical therapy, so obviously he should get speech therapy for swallowing. I am a speech pathologist with an emphasis in voice and dysphagia treatment, and as his justification for therapy, he said to me, "Well, you know that the mouth has muscles, right?" No, sir. I'm obviously an idiot sandwich who has no idea the mouth has muscles. Forget that the patient can't even manage his own saliva or acknowledge the presentation of food or liquid. Thanks for enlightening me. Next story. I went to my OBGYN to talk about getting my tubes tied, fried, and laid to the side. I didn't know it, but she was pregnant at the time, and you'd have thought I kicked her puppy. But why don't you want babies? Having kids just isn't part of my lifestyle. But your biological clock is still ticking. You still have time. I wanted to say that I fed that clock to a crocodile, but I thought she wouldn't get it. But what if your husband wants them? He doesn't, so I hit her with this. He can have an opinion on it when he pushes a watermelon out of his urethra. Finally exasperated, she threw up her hands and said, "Well, I'm not doing it. I can't. Every woman should experience the beauty and joy of motherhood." Then I'd like to see another doctor. Her gasters were flabbered. I went to see a different doctor in the same clinic, and his first words were, "What day would you like your surgery?" That woman had the baby rabies. On one hand, I get it. I'm sure biologically some crazy stuff is going on in your brain that says, babies are life. I have baby and that's good. You know? Like the full primal evolution brain. But like, I don't know. I've never liked the idea of medical professionals trying to talk people out of these procedures that they are perfectly allowed to opt into. Making someone know all of the risks associated or the long-term effects of it, sure. But telling someone who wants their tubes tied, "But what if you want babies?" Yeah, dude, you think they haven't already thought of that? Whatever. Coming from a woman too, hate to see it. Anyway, that's the last story for today. I would like to thank you all so much for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.